Hello guys, welcome back to my channel Ages Kingdom, and in this class I would like to take the topic from anatomy physiology for nurses, and from that respiratory system the topic I am taking, which already I have covered some of the topics with the help of slides, and in this class I would like to take the topic on lungs alone. And the lungs, when you speak about the lungs, I just want to show the image here. The lungs are divided into two. It's by the trachea ending portion divided into two branches, that's called it as a bronchus, and it is a bronchus, the covering soft tissue we form call it as a lung, and this lung is divided the major from the trachea, the major branches which we call it as left stem main bronchus and right stem main bronchus. The main bronchus is divided into bronchi, different branches, and that bronchi is divided into bronchioles. That is divided into bronchioles. Ending portion, air-filled sacs, we call it as a alveoli. That's we call it as a alveoli. So lungs are right and left. It is located and situated in the thoracic cavity. Situated in the thoracic cavity. The main structures of the lung is bronchi, bronchus. Then next secondary is divided into bronchi, and again it is divided into major branches bronchioles, and the bronchioles ending portion we call it as a alveoli. And this is the structure, and everybody knows that the two organs that extract the oxygen from inhaled air and expel carbon dioxide. So everybody knows that starting from your childhood we are studying about the lungs. It takes the oxygen and expels the carbon dioxide, and this is the main and primary organ of the respiratory system. So the bronchus and the large blood vessels are enter into each lung. Then next we'll see what are the lobes of the lung. So before going to the further explanation, the right lung has three lobes. Usually left lung is smaller than the right lung because left lung occupies with a heart, one portion of the heart, that is called it as a cardiac notch. Let's call it as, if you see here I can show the image, the left lung is smaller than the right lung because the left lung occupies with a one part, that's called it as a heart. That's the arch which is compressing the left lung in a lower portion, it's called it as a cardiac notch. So when we speak about the lungs lobes, then the right lung has three lobes and left lung has two lobes, and each lobe is composed of lobules. Each lobe is composed of lobules that contains air passage, alveoli, nerves, blood vessels, lymphatic vessels, and connective tissue. These are the important structures will be there in each lobule. Each lobule. So I just want to show the diagram. So this is the left lung and this is right lung. Left lung, already I said, it has two lobes, that is superior lobe and inferior lobe. Superior lobe, upper portion is called it as a superior lobe and lower portion is called it as a inferior lobe. And superior lobe and inferior lobe is divided by a oblique fissure. This is called fissure. Fissure means which is making the two lobules in a separation. So that's called it as a fissure or a division, and it is formed like a oblique fissure. So that is about left lung. When we speak about the right lung, we said we have three lobes: superior lobe, middle lobe, and inferior lobe. So three lobes are there, and it is having three lobes are divided by two fissures. So one fissure, the upper superior lobe and middle lobe is separated by horizontal fissure, and middle lobe and lower lobe or inferior lobe is separated by a oblique fissure. Oblique fissure. So this is about lobes of the lungs. There are two lobes in the left side and three lobes in right side, and these lobes are separated by a fissure, and these lobes, upper portion lobe is called it as a superior lobe and lower one is called it as inferior lobe, and the right side we have one more lobe, it's called it as a middle lobe. And when we speak about, the picture itself is showing very clearly, the lungs are covered by a one layer, that is protected by the one layer of lung, that is called it as a pleura. The covering, it's a one word answer, the covering layer of the lung is called it as a pleura, and pleura is divided into two separate layers. The innermost layer we call it as a visceral layer. The layer which is directly attached to the part, that is called it as a visceral layer. The next continuation part is called it as a parietal layer. The next covering layer is called it as a parietal. So this is all called covering layers. There are two covering layer is called it as a pleura, and pleura is again divided into two layers, visceral layer and a parietal layer. In between visceral layer and parietal layer, the cavity is their gap, that's called it as a pleural cavity. That's called it as a pleural cavity. Usually the fluid which is circulating in this area between the visceral layer and parietal layer, that's called pleural fluid. Let's call it as a pleural fluid. This fluid is helping for the nourishment of the lungs, and it helps like a shock absorber. It helps like a shock absorber. So this is a major function of the pleural fluid. And when we speak about lobes, already I explained superior lobe and inferior lobe. And superior lobe and inferior lobe is divided by a oblique fissure. And here also the superior and middle and lower lobes are divided by the fissures only. So when we see the image here, you can understand the innermost layer we call it as visceral layer, and outermost layer is called it as a parietal layer. In between the visceral and parietal layer, the space is called it as a pleural space, and this space is filled with a pleural fluid. That is filled with a pleural fluid. So the layer of serous membrane between the visceral pleura and parietal pleura, we call it as a pleural cavity, and it's a serous membrane structure. It contains a lubricating fluid secreted by the membranes that prevents the friction between the membranes and allows their easy movement of one another during the breathing. So it's like a shock absorber, we can say. So that is the other important thing. And when we see the ending portion, alveoli, they are cup shaped outpouching lined by epithelium and supported by a thin elastic basement membrane. So because already I said it's like works like a balloon. When air is filled, it expands, and when air is taken out or exhalation, then it will be collapsed. So it is supported by a thin elastic basement membrane, and they are a cup shaped outpouching lined by the epithelium and supported by the thin elastic basement membrane. With that, you can imagine having a bunch of grapes with each grape indicating an alveoli. So it looks like a bunch of grapes. And alveolar sacs are two or more alveoli that shares a common opening. And these common openings will be attached to the bronchioles. These where the primary exchange of gases occurs. This is about lung structure. So you have to draw the diagram. I need to explain about the location, then lobes, fissures, then about cardiac notch and covering layers, and about alveoli. These are the structures you need to explain about the lungs. And it has, when you speak about clinical importance, most of the time it is a high risk of getting infections very easily, and we call it as a bronchitis, pneumonia. This is the common problems you can see, and in any one lobe there is a chance of developing cancer also. Developing a cancer, or sometimes benign tumors can be chances of developing. So that is all about lungs clinical importance. And mostly seasonal flu like lower respiratory tract infections are very common, means infection spreading to the lungs, bronchioles, bronchitis, then pneumonia. This is very common, and sometimes there may be chances of getting aspiration also. That in children it is very common. It's a aspiration pneumonia. So thank you for watching. If you really like my class, please do subscribe and share, and we'll come up with a new topic. Thank you. Have a nice day.